Have you ever felt your skin itch, become dry, or even flake to the point of discomfort? If this condition keeps recurring, you may be dealing with eczema, a persistent skin disease affecting millions of people. In today's video, we will explore the causes, symptoms, and effective ways to manage eczema to help you better protect your skin. Eczema is a chronic skin condition characterized by inflammation, itching, dryness, and cracking of the skin. It can appear at any age, but is most common in children. This non-contagious disease is persistent, often recurring in cycles, and can last a lifetime. Eczema not only causes physical discomfort, but also significantly impacts the quality of life, making daily activities difficult, causing sleep disturbances due to intense itching, and even leading to psychological issues like stress, anxiety, and depression. Additionally, when the skin is damaged from frequent scratching, patients are at a higher risk of skin infections and other complications. Eczema is one of the most common skin diseases, affecting around 31.6 million people, or nearly 10% of the population, with the highest incidence in children under 5 years old. Research shows that genetic and environmental factors play an important role in the development of the condition. Although there is currently no cure, treatments such as moisturizers, anti-inflammatory medications, and lifestyle changes can help control symptoms, reduce the frequency of flare-ups, and improve the patient's quality of life. Have you ever wondered why eczema is so persistent and uncomfortable? Behind the itching and skin irritation, there are deeper causes that few people realize. Let's explore what truly causes this condition. Causes of eczema. Eczema is a complex condition influenced by multiple factors, with genetics, the environment, and the immune system playing key roles. First and foremost, genetics is one of the primary causes, as individuals with parents or family members who have allergic conditions such as eczema, asthma, or allergic rhinitis are at a higher risk of developing the disease. Research has shown that mutations in the filaggrin gene, a protein essential for maintaining the skin's protective barrier, can cause the skin to lose moisture more quickly, making it more susceptible to irritation and damage from external factors. When the skin's protective barrier weakens, it becomes more sensitive to environmental triggers. In addition to genetic factors, environmental influences also play a crucial role in the development and flare-ups of eczema. Climate changes, especially dry or extremely cold weather, can cause the skin to lose moisture rapidly, leading to dryness and itching. Air pollution, frequent exposure to chemicals in cleaning products, cosmetics, or perfumes can also irritate the skin and worsen symptoms. Moreover, allergens like pollen, pet dander, mold, dust, and certain foods such as milk, eggs, and seafood can trigger immune responses and intensify the condition. The immune system is also a key factor in the pathogenesis of eczema. In individuals with eczema, the immune system tends to overreact to harmless substances, leading to chronic inflammation. The body produces excessive amounts of cytokines proteins that cause inflammation, causing the skin to become red, itchy, and flaky. Additionally, an imbalance in the skin's microbiota, particularly the overgrowth of Staphylococcus aureus bacteria, can weaken the skin's protective barrier, increasing the risk of infection and worsening the condition. Some studies also suggest that viruses, such as the herpes simplex virus, can trigger or exacerbate eczema symptoms in individuals with weakened immune systems. The combination of genetic, environmental, and immune factors makes eczema a chronic condition that is prone to flare-ups and requires long-term management. Identifying and avoiding triggers, along with appropriate treatments, can help patients control symptoms and significantly improve their quality of life. Have you ever experienced dry, itchy patches on your skin without knowing the cause? It could be a warning sign of eczema. Let's explore the characteristic symptoms to detect and manage this condition effectively. Symptoms and signs to recognize. Eczema is a chronic skin condition with characteristic symptoms, including redness, intense itching, and dry, flaky skin. Those affected often experience persistent itching, especially at night, which leads to frequent scratching, damaging the skin, causing cracks, and even oozing if the inflammation is severe. Over time, the skin can thicken, darken, or develop painful cracks. In more severe cases, the skin may become infected from bacteria entering the broken skin, causing further damage, such as pus or hard scabs. Some patients may also have overly sensitive skin that reacts to external triggers such as sweat, sudden temperature changes, or allergens. Eczema tends to appear in specific areas of the body, depending on age. In infants, it typically affects the cheeks, chin, forehead, and scalp, with red dry patches that may ooze. As the child grows older, the skin lesions tend to spread to areas with folds, such as the elbows, knees, wrists, ankles, or even the hands and feet. In adults, eczema usually affects the neck, the backs of the knees, elbows, around the eyes, and the hands, areas that are often exposed to the outside environment. In some cases, eczema can appear all over the body, severely affecting aesthetics and quality of life. The symptoms of eczema are not constant, but fluctuate in stages, with flare-ups and remissions. During flare-ups, symptoms become more severe, with intense itching, red, swollen skin, inflammation, and small blisters. In some cases, the skin may crack and ooze, increasing the risk of infection. These flare-ups can last from a few days to several weeks, depending on the degree of inflammation and how well the condition is managed. Afterward, the disease enters a remission phase, where symptoms gradually lessen, the skin becomes less irritated, and itching decreases. However, exposure to triggers such as dry weather, stress, food allergies, chemicals in soaps, cosmetics, or smoke can quickly cause a relapse. In addition to the skin symptoms, eczema can also affect the overall health and mental well-being of the patient. Intense itching at night can lead to insomnia, fatigue, and decreased focus. Children with eczema may experience developmental delays due to interrupted sleep. Moreover, the condition can have psychological effects, such as stress, anxiety, and even depression, as patients may feel self-conscious about their appearance or face difficulties in daily activities. Since eczema is a chronic condition, proper management is essential to extend remission periods, reduce flare-up risks, and help patients maintain a better quality of life. Eczema is not only uncomfortable, but can also persist if not properly diagnosed and treated. So, how can we accurately identify the condition and effectively manage its symptoms? Let's explore the diagnostic methods and optimal treatment approaches. Diagnosis and treatment. Eczema is a chronic skin condition commonly found in both children and adults, characterized by prolonged skin inflammation, itching, and discomfort. Diagnosing eczema primarily relies on clinical examination, where doctors assess symptoms such as dry skin, redness, cracking, and damage from scratching. Additionally, doctors may inquire about the patient's and family's medical history, as eczema is linked to genetic factors and often coexists with other allergic conditions like asthma or allergic rhinitis. In some cases, allergy tests, skin biopsies, or measuring blood IgE levels may be performed to assist in the diagnosis. Effective treatment of eczema requires an appropriate approach to control symptoms and prevent flare-ups. Common treatments include topical corticosteroid creams or calcineurin inhibitors to reduce inflammation and itching, combined with oral antihistamines to manage allergic reactions. For severe cases, light therapy phototherapy may be used to reduce inflammation and promote skin recovery. Additionally, some newer biologic medications targeting the inflammatory mechanisms of the condition are also being used for treating severe eczema. In addition to medication, daily skincare routines are crucial for maintaining healthy skin and preventing flare-ups. Patients should regularly use moisturizers, especially after bathing, to keep the skin hydrated and form a protective barrier against irritation. Choosing skincare products that are free from fragrances, alcohol, or harsh chemicals is essential to avoid further irritation of sensitive skin. Furthermore, lifestyle changes and maintaining healthy habits can help reduce symptoms and prevent relapses. Patients should drink plenty of water, eat a balanced diet rich in omega-3 fatty acids, vitamin D, and antioxidants to promote skin health. Limiting exposure to triggers such as harsh chemicals, cleaning agents, smoke, cold weather, and stress is also important. Maintaining sufficient sleep and managing stress through methods such as meditation, yoga, or light exercise can significantly improve the condition. With a combination of accurate diagnosis, appropriate treatment, and a healthy lifestyle, people with eczema can effectively manage their symptoms, reduce flare-ups, and improve their quality of life. Eczema is not only an individual issue, but also a public health challenge in the U.S. With the increasing prevalence of the condition, it is affecting millions of people, from children to adults. So, what is the current state of eczema in the U.S.? Current situation of eczema in the U.S. Eczema is a common health problem in the U.S. and affecting millions of people across various age groups. The disease tends to appear early, usually during infancy and childhood, but it can also persist into adulthood or even throughout life. Recent studies have focused on understanding the genetic, environmental, and immune responses related to eczema, as well as exploring the connection between eczema and other allergic conditions such as asthma and allergic rhinitis. Furthermore, some studies indicate that factors like environmental pollution, climate change, and modern dietary habits may increase the risk of developing eczema or worsen its symptoms. Thanks to advancements in medical research, many new treatment options have been developed, including biologic medications targeting specific immune mechanisms, which help manage symptoms more effectively and with fewer side effects compared to traditional methods like corticosteroids or systemic immunosuppressive drugs. New drugs, such as dupilumab, have shown promising results in reducing inflammation and preventing flare-ups. Additionally, gene therapy and studies on gut microbiota are opening new avenues in eczema treatment. Alongside medical treatments, disease management strategies are also improving, emphasizing regular moisturizing, avoiding exposure to irritants such as harsh chemicals and soaps, and managing stress, a factor that can trigger flare-ups. Public education on eczema is also receiving more attention, helping patients access information and appropriate treatments, which significantly improves their quality of life. Dealing with eczema is not only an individual journey, but also a community story. In the U.S., many organizations and support groups have been established, helping patients access information, treatment methods, and empathy from others in similar situations. Let's explore the organizations that are making a difference in the lives of millions living with eczema. Community support and organizations. In the U.S., many organizations and associations have been established to support people with eczema, providing information, resources, and connecting them with medical professionals. One prominent organization is the National Eczema Association, a leading nonprofit organization dedicated to providing scientific knowledge, supporting patients, and promoting research on eczema. The NEA regularly organizes workshops, online forums, and provides educational materials to help patients better understand their condition and how to effectively manage symptoms. In addition to the NEA, many other medical organizations, such as the American Academy of Dermatology, are involved in research and awareness-raising activities, helping the community access the latest treatment methods. Alongside the support from organizations, many awareness campaigns have been launched to help the public better understand eczema, eliminate stigmas, and improve the quality of life for patients. One notable campaign is Eczema Awareness Month, held every October, where medical organizations, dermatologists, and patients share experiences, scientific information, and skincare solutions. Additionally, programs like the Eczema Expo are organized to help patients and families learn about new treatment methods, connect with the community, and receive support from experts. Thanks to the ongoing efforts in community education and scientific research, more and more eczema patients in the U.S. can access effective treatment solutions, allowing them to live healthier lives and reduce the negative impact of the condition on their daily lives. Eczema, while a chronic condition, can be managed and its impact on quality of life improved with advancements in medical science and appropriate care measures. If you found this video helpful, don't forget to like, share to spread the word, and subscribe to the channel to stay updated on more important information. Thank you for watching.